So we're going to start moving towards AI. So you also use AI to discover new antibiotics. So what does that process look like, and what role do you see AI playing in our society right now or in the future?
Yeah, so a few years ago, we teamed up with Regina Barzilay and Tommy Giacola, who are two AI professors at MIT, about seeing could we harness the power of AI to address the antibiotic resistance crisis, this highly concerning crisis going on in the background of the pandemic, that bacterial pathogens are growing more and more resistant or less susceptible to being killed by our current antibiotics. Interestingly, for your listeners, watchers, viewers of this podcast, that the golden ages of antibiotic discovery in the 1940s, 50s, and 60s, basically before the biotech revolution, before the AI revolution. We took this on, and what we did was really quite straightforward. We put together a training library of 2,500 molecules of drugs, basically 1,700 FDA-approved drugs, as well as 800 natural compounds taken from plants and insects. We apply these to E. coli, a bacterial pathogen and commonly used model organism in biotech labs, and asked which of those molecules exhibited antibacterial activity as evidenced by inhibiting the growth of E. coli. We then took that information, just saying yes or no, antibacterial or not, along with the structural information on each compound, and trained a deep neural net, so an AI model on computer, that could look bond by bond, substructure by substructure, scaffold by scaffold within each molecule to associate it with being with antibacterial activity or not. We then took that trained model and applied it to a number of different large libraries of compounds that are found in computers, and asked which of the molecules in those libraries are predicted to make for good antibiotics but don't look like existing antibiotics. And on the first library, which consisted of a drug repurposing library of 6,100 molecules, only one molecule fit that bill, and that was a molecule we called Halosign, which turned out to be remarkably potent, so very strong against multi-drug resistant, extensively drug resistant, pan-resistant pathogens. We then also applied to a very large library, 1.5 billion molecules, demonstrating that, again, we could find a number of new molecules. In this case, we identified hundreds predicted to be new antibiotics. We tested 23 or 24 of these, 8 of which turned out to be very powerful antibiotics, 2 of which have activity against major pathogens. Our direction now is we've launched what we're calling the Antibiotics AI Project at MIT, a very exciting effort to use AI both to discover and design novel antibiotics, really with the audacious goal and with support from the Audacious Project that's part of TED, to discover and design 7 new antibiotics against 7 of the world's deadly pathogens over the next 7 years. And it's ambitious, but we are confident we can actually make great progress.
Yeah, so talk about Halosign, and once again, it's a new first new antibiotic compound in 30 years, kills over 35 powerful bacteria. So what do you see? Do you see Halosign having a role currently in COVID-19 right now?
You know, it's interesting, and what's been underappreciated in COVID-19 pandemic is the important role of bacterial infection. So COVID-19 is a viral infection, but 1 out of 7 patients who are hospitalized with COVID-19 have a bacterial co-infection. 50% of the patients who die from COVID-19 have a bacterial co-infection. Going back to the Spanish flu, which we don't hear so much about anymore, but of a century ago, it was more deadly in terms of its impact across the globe than the current pandemic. And it was largely so deadly because of bacterial co-infections, and it was in the age before antibiotics. Halosign, I think, is interesting and promising. It has some toxicity issues that we're now working on through a medicinal chemistry standpoint and looking to see if we can maintain its high activity against the pathogens, but reduce its toxicity against human cells. But at minimum, it could serve as a very powerful topical antibiotic against nasty pathogens like Acinetobacter baumannii, which are often found in skin wounds.
Yeah, so I'm going to ask you a question. So recently, there are many companies, you probably heard Neuralink, that was created by Elon, and several other companies they've been trying to create a brain-computer interface. So what do you have to say regarding this potential emerging technology that could save a lot of lives?
You know, I think the brain interface, I don't think that technology will necessarily save lives as much as enhance the life of individuals who have lost their ability to control limbs in a meaningful way. I think the advances I've seen are quite exciting. So we were interested in this going back 30 years ago, and the challenge there was getting after suitable interface with the proper number of neurons. That's advanced, still in an invasive manner, so I'm hopeful for non-invasive. but also our ability to learn and break down the patterns that are produced and understand what they might mean have advanced very nicely. And I'm hopeful that they'll continue to advance with these various efforts in the coming decade or so. We've seen some very promising things, but it still remains a big challenge of working out the relationship between the signals that are collected directly from the neurons or at the surface, say of the scalp, from the brain, and what's being intended by the person generating those signals. And I think we need further advances in the electrode interfaces and further advances in the AI abilities to break down those signals.
Drunk mistakes, we're bound to hit the